Let's see. Okay, we're getting some few people in this morning. Good morning, May. Good morning, Texas, Edgar. So you got a primary care provider here, and I'm dual live streaming on both here and on YouTube, so that in case we get into some good conversations, you can go back and view it later. Um, Glad to have you with us. Wanted to know, kind of what's on your brain this morning. Um, the I am also trying to get my morning, uh, getting my water started for the day. Good morning, Chris. Mudflap. Jimmy. Good morning, everyone. What kind of questions do you have for a primary care provider? I'm pretty much open to any topic. The only thing I cannot do is I cannot give you direct. Thank you, Thomas. Good morning. The only thing can't do is give you direct medical advice. I can tell you what I might do in your situation, but it's kind of limited like that. So just be mindful that any advice I give you is more along the lines of if I were you, rather than complete, medical gospel. Still, I'm open to any topic. Cassandra, good morning. Larry, hope everybody's there this morning. Pat, good to see y'all. User, I love it. Look, almost any time you can go user. Good morning. Number one way to get your cholesterol down is through red yeast rice is the best supplement for that. They usually come in 600 to 1200 milligram tablets. The daily dose is 1200 milligrams. Obviously, avoiding things raise cholesterol like fried foods and there's all those things too. I'm glad you asked. All right, I'm going to stay on Trulicity for just a little bit, y'all. So why is there a shortage on Trulicity? First of all, it's supposed to be resolving hopefully by the end of this month. It's already getting better. I have been able to get the 3 and the 4.5 milligram doses um, recently again. And the reason why it ended up it was kind of a side effect of the Ozempic. Um, it was a side effect of Ozempic, the manufacturing issue with Ozempic, when you couldn't get the higher doses of Ozempic, everybody switched to Trulicity, causing a sudden artificial demand on Trulicity, and therefore it caused it to run out. I don't necessarily like the way Lilly handled the shortage. I really don't like the way Novo Nordisk handled the shortage on Ozempic. But either way, that is what it is, and it should be resolving soon. So, I'm sorry, Thomas. I have no advice on gambling. Um, so, tell me, why are you asking the question about Tylenol, Eric? I'll be happy to answer the question, but I mean the general answer is it's generally considered for no more than 4 grams per day or 4,000 milligrams. But why are you asking? Good morning, everyone that's coming in. You haven't had it at all? My recommendation is Mudflap is that you ask your doctor to reduce it to 1.5 milligrams until the shortage is over. So go back, have them order it until the higher doses are available. But that's much better than going without it. Yep, I know BI. My current BI reps are for Stiolto, and they also co-promote the Lilly products. Why was it lowered to 3,000 milligrams daily? The number one reason why it was lowered is because too many people were pushing the boundaries. I think they figured out if they lower it to 3,000 milligrams, that maybe people wouldn't get so close. I think when people think in terms of 4 grams, they only think in terms of tablets, and liquid cold medicines and stuff contain Tylenol, and so people were still eating too much Tylenol each day. So that would be why. Metabolically, it's 4 grams is still okay. No worries. What else y'all got this morning? Let's see here. Get fit. Good morning, trucker. Billy, Tim, Kimberly. Good morning, everyone. I hope everyone's doing here. So, what else we have on our brain this morning? I was thinking about some of the struggles of weight loss and some of the struggles of. So yesterday was one of those days um, where I wasn't quite on plan. I am an Optavia coach, among other things, but yesterday was not one of my on plan days. This is my pre-workout, and the reason why I drink pre-workout most days has nothing to do with my workout. It has to do with, for some reason, if I drink a pre-workout first, it leaves me thirsty and gets me started on my 64 ounces of the day. So what else we got? New topic. By the way, I'm going to be getting a stand for future things, so I will wobble less. Come on, wobble, baby, wobble, baby. Anyway, um, what else do we have on our minds this morning? Any other questions? Red yeast rice. Again, the dose is 1,200 milligrams a day. Let me give you a little bit more on that. What can you expect with red yeast rice? I would expect about a 15 to 20 point drop in your LDL. Not a lot more. What red yeast rice is essentially, it is the molecule by which we began to learn about statin medications anyway. So it's basically an all natural statin, and people like to joke about things being people like to lay a lot of claim on things being all natural, but it really is pretty useful and well tolerated. None of the muscular side effects, but also considerably weaker. So if you need if your bad cholesterol is sitting around 150, red yeast rice might get it down into the 120s, but it won't get it below 100. So just be mindful of that. Remember, sometimes it's not your diet. Sometimes it's not your. Sometimes it's just your genetics. And some folks need to take cholesterol medicine because of the consequences of just having cholesterol. And it's not you could have I have folks that need cholesterol medicine have BMIs of 18, and they have fantastic diets, but they have terrible heterozygous familial hypercholesterolemia. So um, just be mindful of that. Use the red yeast rice first so that you know that you've done everything within your power. But then, if you end up having to go to a statin after that, it's not nothing you're doing. Okay. Anyway, back on diabetes for a minute. And you're welcome. But back on diabetes for a minute. What do y'all think of what you're hearing about Manjaro? That's Lilly's new molecule, and I'm kind of excited about it. It looks to be that it's going to get a weight loss indication that's going to be even more impressive than Ozempic / Wegovy. And Wegovy had some of the best research findings of any weight loss medication up, before that its launch. In the study, over the course of a year, um, Eric, I think you may be right. We'll come back to that idea in a second. But in a year on the Wegovy or Ozempic product, 50% of the participants lost 20% of their body weight. My HDL is 235, trying to get it under. I think if you mean your LDL there, because you're not. Yeah, Sherry. Unfortunately, you're like me. I can't take GLP-1 therapy. Um, I don't disagree with that user, but let's stay with Sherry for just a second. Sherry, I can't take it either. It causes a lot of. I suffer from really bad gastritis, and when I tried Manjaro, the lowest dose, I I almost ended up having to have an emergency CT, thinking that I was having ulcerative colitis. Uh, so some people don't do well with GLP-1, but for those that do, and that they are by far the majority, it is it's just really a game changer. And as far as it being a hype user, I don't blame you for feeling that way, but inconsistency and having a genuine diet plan and a genuine not expecting the medicine to do more than it's supposed to do. You're not wrong about that. Good morning for everybody that's rolling through. But the that doesn't make the drug a hype. It really is. It's a game changer. It's so much of a game changer that it was so much of a game changer that oh, wait a minute, Sherry, let me get before you give up on GLP-1 though. Ask, and I know they said if you have pancreatitis, you can never have GLP-1 again. Ask your doctor to consider trying low dose Rybelsus, the oral GLP. Um, Believe it or not, they're moving back away from the if you've ever had pancreatitis with the GLP-1, it's an absolute. I'm just saying, have a conversation. Okay, it's not the same. It's a very, but it allows a very slow buildup. Oh, pancolitis. Oh, okay. Either way, um, just have a conversation because it may be that there may be a way to familiarize your body with the molecule without putting you back in the same pain. Okay. Yes, I can actually, Marcy. Rybelsis, Rybelsis. Now, high triglycerides are connected to diabetes because when your body is trying to process hyperglycemia and it's trying to get rid of all that, it uses the liver. You're welcome, Sharon. It uses the liver to try and to uh, to basically find a new place to store it, but then that causes the liver to be inefficient in what it does. And that's why the higher your sugar is, the triglycerides will automatically follow it to the point that if I have a person who has uncontrolled diabetes and uncontrolled triglycerides, I don't even try and figure out how to manage the triglycerides until I get their A1C down. And then I can clearly see what I need to do with their triglycerides. So the key thing about it is whether we can fully explain the connection or not. The most important thing is we know that it's an absolute linear ratio. Higher the sugar, higher the triglycerides, higher therefore higher the acute heart attack risk. So you got to get that diabetes down. But regardless, and when it comes to like putting you on a medicine like fenofibrate or things like that for triglycerides or some of the CEPAs and things, I always get the diabetes fixed first, and then most of the time the triglycerides will come down at least 75%, and you can figure out what you need to do. Good, that's good. Yeah, it's the most important thing is some. One of the things I love about chronic disease, and I don't love chronic disease. It's a frustration when people have it. But one of the things I do love about chronic disease, so just like when a chronic disease goes badly, it makes lots of other things worse. When you begin to work fervently, diligently, and intentionally on one aspect of your chronic health problems, fixing that one also helps set up the other dominoes, help stand them back up too. You can make so much impact if you just buckle down and focus, and especially if you're a diabetic, if you just focus on keeping your sugars controlled, not eating foods that are messing up your glycemic index, and quite frankly, being on some of the better agents that because nowadays it's not even just getting your A1C down is not my only goal. As a matter of fact, I can almost get anybody if they're going to help me at all, do anything adherent with them. I can get anybody below 7. The medicines nowadays do so much more, whether it be the SGLT2s, the DDP4s, the GLP1s. A complete thank you. You're not wrong, Proud. You're not wrong. That do you understand? So let me talk about sugar logs since you brought that up. Proud said that A1C is not the great indicator we once believed. And here's how I say it, that because you're absolutely right. It is a very it is a useful piece of clinical information that tells you a whole lot about where you are and zippo, nada, zero about how you got there. That's why when you go to see your doctor, you need to bring your sugar logs. Your sugar logs are far more um, uh, Leonard, I'm gonna come back to kidney damage. I want you to clarify your question. But let me answer this question. Let me do this thing about sugar logs for just a minute. And Leonard, I'm gonna come back and ask you that question back. And I ask y'all to kind of pause for a minute because that's two great topics at this moment. But your sugar logs are far more clinically useful to me as far as determining what's going on with you than your A1C will ever be. Um, your A1C is a couple of things. It's a lie detector. So when you tell me that you're doing everything or that your sugars are running 120 and your A1C is 15, probably not true. Okay. And it is also a good, trending number. So it gives you a better how's my overall plan of care. But my game time decisions, the decisions that I need to make while you're at your visit, are absolutely the product of what's going on with your actual sugar readings. Now, Leonard, let's go to you. What damage did I'd like you to clarify your question. What meds? What medicines are we talking about to the kidneys? Are you talking about with GLP-1s, or are you talking about with other diabetes meds? Are you talking about which diabetes meds are good for the kidneys and maybe which ones are not so good? What's your question? Lots of great people coming through this morning. I just want to let y'all know that I really appreciate y'all. Thanks for joining me. Again, this chat will be available on my YouTube page. My YouTube page is Dr. Mike Says. So, okay. Since Leonard's not clarifying yet, I'm going to go ahead and give you some information. First of all, most diabetes meds now are helpful to the kidneys, okay? Or they're at least not harmful, okay? They're at least not harmful. So let me explain. SGLT2s have been found to reduce and slow. Okay, that's fine. Leonard, I'll get back to that. But SGLT2s, medicines like Farxiga, Jardiance, Stiglatro did not get the indication, but it's certainly not harmful to the kidneys. And even Invokana, although it's Invokana prescribing is almost zero now. But my point being is, not only are they not harmful to the kidneys, but they're actually very beneficial to the kidneys. They do a very wonderful thing in reducing pressure on the kidneys as they do their job and slowing down and even reversing chronic kidney disease. Sulfonylureas, kind of a mixed match. Obviously, metformin is a problem when you hit chronic kidney disease stage 3, which is when your EGFR. Good morning. Which is when your estimated glomerular filtration rate is about 60% or less. You begin to go, oh, we need to start getting rid of metformin. And for those of you that like to hate on metformin, if you've ever had to have somebody that was on metformin and ever had to take them off of it, it's very hard to manage their diabetes. So metformin is not a terrible drug, but it is when you're in chronic kidney disease, you got to stop it. You can't keep doing that. Your doctor doesn't like to prescribe that to you, Jessica. I'll come back to that. Fiora said migraines, it's useful. I never read my labs, but I'm going to stock. Doc says labs are normal, no meds. That's awesome. You should absolutely trend your thoughts on that. Before I get to balance of nature, Jessica, I'm gonna try and do a video later about migraines. I think that one I probably should start a series on that. We should all keep a sugar log. Let me ask you a question on sugar log, and I'll come back to I like Balance of Nature, by the way. I don't know that I think it's a cure-all, but Shazam, absolutely, you should have it as a supplement. It's perfectly fine. Um, but the sugar log, you should absolutely keep it because let me ask you a question to challenge diabetics. How crazy is it that we ask you to check your sugar, but we never look at those numbers? Think about that. If I would ask you to check your sugar, it's not just about your self management. It's supposed to be managing your, I'm supposed to be uh, helping you determine what is good and what is bad and helping you see what what foods tend to cause your sugars to spike. So everybody should keep a sugar log. Not everybody has to check their sugar multiple times a day, though. As a matter of fact, depending on what medicines are, um, depending on what, okay, I'll come back to that. But depending on what medicines you're on, um, I have some people that I only have them check their sugar 3 times a week. But you consider if I had you check your sugar 3 times a week and I see you every 3 months, that's still 30 or 40 readings. Okay. And then maybe on another live, because I'm going to be finishing up in about 10 minutes. But another live, I'm going to talk about, um, what I call postprandials. Anyway, and I'm going to tell you, proud, I never not want to know what someone's urine creatinine is, what someone's serum creatinine is. I never not want to know. If I'm drawing blood for any reason, I'm checking kidney function, which is part of that. Uh, period. And the reason why is because it is probably the greatest overall indicator of the current and general health of your kidneys, and you cannot underestimate its value. I never not want to know. If I'm drawing blood, if I'm drawing genetic testing while I'm there, it's one of the cheapest tests. I'm going to go ahead and check your kidneys too. So that's why. Now, check my sugar daily first thing in the morning. By the way, usually that's fantastic, but you should do some postprandial readings, and those are the ones right before dinner. And I call it postprandial is the redneck way of saying I done ate. Okay. Prednisone. Jessica, I think that's back on migraines, and I apologize. I think we may have, the next time I go live, we may just focus on migraines because I don't think I'm going to be able to adequately answer your question today, and I apologize for that. And well, okay, but hold on a second. You said you're 74, you're on no meds. I don't know. I understand what you're saying. You should pay attention. Okay, you should be aware, but I wouldn't sweat it. I mean, honestly, if you've made it this, listen, if you've made it this far and your labs haven't gone abnormal, there's no reason to just think you're just going to go screwy in a 24-hour period. So do I think you should be aware? Yes. I also understand why you're not. Praise God, he got you this far. And, I like to say when you reach, I'll tell you that we're paying attention. That's the whole point of having a PCP. We pay attention so that you don't necessarily have to. But I will say this: at this point, it's a PCP's job, user, to stay out of God's way because He got you this far, and He'll take you the rest of the way too. And just really glad when I know that's my job. Now, the one thing I will say, user, I would like you to go twice a year. I think that there's enough that could happen at the age of 74 forward that checking your kidney function things twice a year is really good. I practice in Winston-Salem, North Carolina. For those of you that are asking that. Pre-dinner blood sugar determines what my dinner options are. That's very good. That's another reason for postprandial. The other thing is, Marcy, the reason why you do postprandial readings or I've done 8 readings is because you're looking for excursions. What happens to your sugar, to your body when it's actually working on food. Okay, so I'll again, the topic for a future thing. Just really glad at all the participation today, y'all. We're going to be wrapping up in about 5 minutes. So anybody have something that they think might be a quick question? Because it's, yeah, okay. Let's Okay, Desi, I think you have the great topic to finish with. The question is, do I believe that vitamins work? And the question is, I mean, I will answer the question in the beginning. Leela, that's not a short one. I appreciate you, and I want to get to that one too. Why don't you go to my page and put up for question and answer, and I'll create a video about IBS. Go to my Q&A page and ask me specifically that one. I'll get to it, I promise. Anyway, back to Desi, vitamins. The question I would ask is, what do you expect them to do? Okay, so absolutely. This goes back to balance of nature, fruits and vegetables and things like that. Most people do um, don't do enough vegetables, and they are vitamin deficient. Or as we get younger, okay, you hear the sarcasm there. As we get younger, our ability to intrinsically pull the vitamins out of our food also begin to wane. So I do like vitamins because but I don't expect them to cure things that they were never intended to cure. So let me tell you the vitamins. I actually have a video on my other. So I have two different accounts. On my other account, I have a video that basically talks about the vitamins I take every day. So I'll just go down them briefly. I take a vitamin E. I take 5,000 units of vitamin D. I take a Super B complex. I take a magnesium, a potassium, and these are all over the counter strength. None of these are pharmaceutical grade. Oh, thank you, Marcy. I'm taking new patients. Called Complete Primary Care. You can Google it. Complete Primary Care in Winston. Anyway, so let's see. I told you vitamin C. I take about 500 milligrams of that, but I don't expect it to do anything more than just complete what I might be missing in my diet. And yeah, yep, thank you. Usually you're going to be, I feel much better with that twice a year. Magnesium is just, I just take it over the counter. I don't really, there's a 250 milligram, there's a 400 milligram. I don't care which one. Um, and I take Balance of Nature, not because I care. It just, does it help blood pressure? A little bit, very little bit. Yep. Jessica, again, question and answer. Go to my page, do the question and answer thing, and I will start making some videos about migraines because I want to talk about CGRP therapy, Jessica. I want to talk about the goods and the bads of Topamax. So go ahead and do that. And no, I don't, Willow. I don't generally take a multivitamin. I just take the one. I kind of pick those. Um, the reason why I don't take a multivitamin myself is I find that most of the commercial formulations, your body has a hard time picking those out. Now, there are some vitamin packs that are more organic preparations, kind of in a better solution, and they're almost always 5 or 6 that you have to take at once. You know those vitamin packs, um, potassium and magnesium. And vitamin E is for a lot of things: hair, hair health, nail health, skin, um, just mostly all things outside. Anyway, so um, I like breaking up and getting those individual vitamins. They have Caltrate and it, user. I think it's either one. I don't think it really matters because again, what you're doing is you're only going after trying to get the body what the body might not be getting in your diet. It's somewhat theoretical. Biotin is fine. I like that for hair and nails as well. Um, I just tend to do the vitamin E myself. I don't worry about getting specifically biotin. But anyway, that's my. You know what? That's called Baskin Robbins. We all have our different flavors. It's okay if you're a biotin fan. I think it's fantastic for people who like it. If my potassium is very low, can it be harmful? Yes, it can be. However, that's a conversation between you and your doc. Okay, because if your potassium is really low, there's usually a reason why. So just have that conversation. I can't really give you much better advice about an electrolyte imbalance specific to you here. All right, y'all, we're at the 30-minute mark. I have thoroughly enjoyed your company this morning. You've been fantastic. Thank you for everything. And I will talk to you all soon. Goodbye.